then next we have the keynote speech given by His Excellency Ouyang Yujing, Ambassador of the People's Republic of China to Malaysia. Ambassador, please.
Honorable Mr. Kerry Jamaluddin, Honorable President Wang Chen, President Zhang Xue, dear President Kung Cheng-Qi, ladies and gentlemen, good afternoon. Today, I'm honored to attend Ms. Dr. Wu Lieh-Teh International Conference 2022. On behalf of the Embassy of the People's Republic of China, I would like to present the warmest compliment to the conference and the highest tribute to the host. Dr. Wu, who was born in Malaysia, was an outstanding ethnic Chinese and has made crucial contributions to the establishment of the modern medicine in China. One of the most remarkable achievements of Dr. Wu was leading the fight against the 1911 pneumonia plague pandemic in northeastern China. At that difficult time, Dr. Wu accepted the mission's impossible and managed to put out the plague within 4 months, saving millions of lives. In the face of the rampant COVID-19 pandemic nowadays, it is a high time for us to commemorate Dr. Wu's merits together. We should learn from Dr. Wu's scientism spirit of the seeking truth from the facts. Dr. Wu has initiated pioneering efforts in modern medical methods in order to curb the plague from the spreading. Dr. Wu decisively implemented measures such as cremation and quarantine, and invented and advocated facial masks, which had been proved very effective even today in fighting COVID-19. In our fight against the COVID-19, science remains as a magic key for the humankind to defeat the virus. Scientific weapons should be equipped to eliminate the virus. It is necessary to give full play to the technological advantage of the modern medicines and further strengthen the research on the COVID-19 mutation. It is also vital to build a multi-tiered defense lines against the pandemic by increasing vaccine protection rate and the vaccination rate, and actively carry out research cooperation of the specific anti-COVID-19 drug. Science-based policies should be applied to contain the pandemic. The fight against the COVID-19 is an all-out war, and every country has its own specific circumstance. It calls for a systematic response followed by the law of the science and coordinated policies that fit each country's interest most. We should probably handle 3 sets relationship. For example, between pharmacological and non-pharmacological intervention, targeted routine COVID-19 protocol and emergency measures, pandemic control and socio-economic development. It is also crucial to have an outlook for the post-pandemic era and to prepare for the economic recovery. Ladies and gentlemen, we should learn from Dr. Wu's internationalism spirit of the global vision. Dr. Wu was born in Malaysia, studied in the UK, and traveled a long way to China. He devoted himself into the medical construction and made outstanding contributions to the medical cause of both Malaysia and China. This spirit of the internationalism is also what we need today in the fight against the COVID-19 pandemic. The severe challenge posed by the pandemic has fully demonstrated the very fact that the countries are not riding separately in some 190 small boats, but are rather all in a giant ship on which our shared destiny hinges. Standing united represents the only right ways to defeat the pandemic. Since the COVID-19 hit, China has quickly contained the domestic spread of the pandemic, which not being satisfied with clearing its own house. China has, from the very beginning, been committed to helping others affected by the virus. We took the initiative to engage in the international cooperation against the COVID-19 and made contribution to the global public health security. China started with the global emergency humanitarian assistance, kicking off the first half of the international campaign against the coronavirus with a focus on providing emergency supplies. Up till now, China has provided about 372 billion facial masks, over 4.2 billion PPEs, and more than 8.4 billion testing kits to the international community. After that, we began focused on the vaccines cooperation as the international campaign against the virus entered its second half. In order to make the COVID-19 vaccine as a public good, China has accelerated equitable access to vaccines in developing countries and supplied more than 2.1 billion doses to over 120 countries, as well as international organizations. So far, China has become the biggest provider of the outbound vaccines among all the countries. 1 in every 2 doses of the vaccines administered globally is made in China. For many countries, especially developing ones, the first batch of and the majority of the vaccines they have received came from China. Ladies and gentlemen, we should learn from the Dr. Wu's humanism spirit of the putting the people first. Dr. Wu insisted on treating patients and conducting research on the front line. His behavior fully reflected the benevolence of the doctors who are compassionate enough to disregard the danger of the plague when it comes to the matter of life and death. The battle against the COVID-19 is one for people and by the people. The Chinese government adheres to putting people and their lives first. For the past 2 years, China has been trying to put the pandemic under control and thus provided solid guarantees for the social stability and economic development. With the change in the global pandemic situation, the speed of the transmission of the new variant Omicron is fast. The rate of the heightened transmission is high. The measures for prevention and containment are more difficult. Facing the new challenges, China upholds policies such as quickly detecting the virus and blocking the transmission of the pandemic to maximize the protection of the people's health and life safety. China's fight against the pandemic is a vivid example of the creed of the Communist Party of China that serves the people and reinforces the moral concept of the Chinese civilization, that there is nothing more important than human life. Ladies and gentlemen, China and Malaysia are good neighbors sharing 1,000-year-long friendship. Facing once-in-a-century pandemic, the governments and the people of China and Malaysia has forged close ties in the fight against the virus, work together for economic recovery plans, and thus refresh the traditional friendship. In the early days of the pandemic, Malaysia provided China a large amount of the urgent needed medical supplies in a timely manner. After the initial containment of the pandemic, China extended a helping hand to Malaysia. manifesting the precious friendship of climbing mountains and crossing detached together. Vaccine cooperation is one of the highlights of our bilateral anti-pandemic efforts. On top of the vaccines that China provided to Malaysia in the past years, China has also encouraged Chinese companies in transferring vaccine technologies to developing countries and launched joint vaccine production with 20 countries, including Malaysia, in the aim of the annual capacity of over 1 billion doses. Looking ahead, China is ready to enhance the communication and coordination with Malaysia in order to deepen our cooperation in the fight against the COVID-19. We could explore cooperation in research of the specific anti-COVID-19 drugs and the procurement of the new variant vaccine. Simultaneously, China will strengthen cooperation with Malaysia in an entire chain of the vaccine clinical trial, production, and the research development. Ladies and gentlemen, there is a saying in China, admiring a great virtue is like looking up at a high peak. We should not only commemorate predecessors' outstanding achievements, but also inherit their great merits. I have a long belief that as long as we join hands and stand shoulder to shoulder with each other, we will indeed defeat the pandemic, build a global community of health for all, and safeguard a healthier and a bright future for humanity. Thank you.